at the state public health lab to be able to determine what percentage of our population has been exposed to COVID-19 and developed antibodies for that. We're doing this study in conjunction with the UNR School of Community Health Sciences and their epidemiology researchers there and the State Public Health Lab. In order to do this, we have identified randomly selected households throughout Washoe County that have been invited to participate in. We ran the first specimen collection yesterday. We had 160 individuals come through. We had additional staffing through the Nevada Guard for the specimen collection, with medics and nurses assisting us with that through the post. And we were able to get that accomplished with the blood draws for 160 over a 4-hour period or so. In addition, we collected the nasal swab tests for the COVID-19 testing as well from 238 individuals yesterday. So that was a busy day for us, a different kind of operation through the post. It all went very well. We're operating the post this morning for the normal drive-through testing for COVID-19. And then this afternoon, we have another about 90 people coming through for the blood draws for the seroprevalence study. So that will complete the sample collection for that study. And the UNR team will be working with us to analyze that data and calculate for us what the spread of COVID-19 has been to date in Washoe County. So we're excited to get those results as they're able to get that study completed, and we'll be releasing that to the media as they're available. Because of the work that's been going on with the seroprevalence study, I'm afraid we're a little backed up, and I don't have updated numbers for you right now for case counts as of today, but we'll be providing that information later as we have it available. I can give you the update. I think you've probably seen it from yesterday. We had 16 additional cases. Sadly, we had 1 additional death. So that brings our total deaths in Washoe County to 66. Our total cases to 1,788. We did have 17 additional recoveries, so 1,155 recoveries in Washoe County, and hospitalizations have been increasing. And so we have 72 people hospitalized and 136 people released from the hospitals. The hospital capacity remains good with plenty of hospital beds available, and the ventilators yesterday were at 19% ventilators in use. So that's the good news, is we still have plenty of hospital capacity. What we have seen, though, is that since May 10th, and about the time of the reopening, we have seen an increase in cases that are occurring here in Washoe County. On Friday, we reported 40 new cases occurring, and that was the 6th highest day of new cases that we've had. So it's important to recognize that we are not through this just because we have reopened. And with the reopening, we have increased potential for the spread of disease, because now people are not staying at home as much. They're out in different settings, commercial settings within our community, and there's the increased interactions and potential for spread of disease. So yesterday, the governor issued an announcement noticing the uptick that we've had in cases in Nevada statewide, and also noting that the positivity rate of the tests had switched and was now increasing. As we had been doing community-based testing and opening it up more broadly, we had seen the positivity rate declining. But I think that's of concern to see the positivity rate increase yesterday, and we'll be watching to see if that's a continuing trend. But I think that the important thing is to remember that we still have COVID-19 out in the community being spread. We have high numbers of cases that are being reported. So people should not let their guard down. We should continue to be germaphobes and do everything that we can to try to prevent us getting the disease and spreading the disease to others. I would also remind everybody that they should maintain awareness of how protective different businesses are with how they're operating and with the clientele that they have. And so if you are observing that people are not wearing face coverings and are not socially distancing in settings that you're getting into, please evaluate that situation. And I would advise you to leave that business and take action to protect yourself by not being in those circumstances. So we need to be aware and continue to be vigilant as we're moving forward so that we can be successful with the reopening. Yesterday, the governor announced or issued the directive that allows for reopening of K through 12 schools. And so there's a lot of work that's being done in how to do that in a safe manner. The Washoe County School District had some discussion of that during their Board of Trustees meeting with extensive work and different scenarios that they're considering. But that's another future event that could lead to much more interaction between people coming together for educational purposes that can further complicate the movement forward in how we're working to be successful with reopening the economy and preventing the spread of the disease. And we're working closely with the school district in those efforts as well. So that's, I think the other piece, is that's significant that the governor announced yesterday and that we're seeing here is the increase in the number of people that are hospitalized with COVID-19. And so while some may attribute the increase in new cases that we're reporting to the expanded testing that's being done, the trend of seeing more people hospitalized really is of concern because the severity of the disease is not something that's determined based on increased testing. So the fact that we have more people that are becoming severely ill enough that they require hospitalization is also a strong indication that we're seeing an increase of cases of COVID-19 that are occurring. So that I'd open it up for questions.
Thank you, Kevin. We have one in the comments section from New York Times star Kenzie Bales. She said a coworker got an email from LabCorp saying they were offering antibody testing right now. Are you guys working together on that, or is that something they're doing independently?
We are not working with LabCorp on the testing. They are commercial labs that have antibody testing that's available through them. And I know people are getting tested to see if they have the antibody or not. My recommendation, if you're doing that, is to understand which antibody test they're using at that lab and whether it's one that is FDA approved and is a reliable test, because I think everybody's aware there's a number of different tests that are on the market. The health district's work with the antibody test is a science-based approach as far as the population that we're sampling and testing in order to have a confidence level, 95% confidence level in the results of that's representative for our community as a whole. The testing that happens with LabCorp and others is if people are self-selecting for that test, then the test may provide information for that individual of whether they have developed antibodies or not, but it's not a scientific method that would be representative of the community. And so those results don't really provide us good information on what the degree of spread has been and the prevalence of COVID-19 in the community.
Thank you, Kevin. Any other questions?
Yeah, I have a question. Can you hear me?
Yes.
Yep, go ahead.
Hey, this is Carson Bush just with News 4. Kevin, heard some possibilities of some cluster cases in some warehouses in the area. Can you confirm that, what you've heard about, anything with that?
I am aware that we have had some clusters that have occurred in warehousing, in manufacturing. We've had them in construction settings, landscaping, of course, some of our long-term care and assisted living facilities. So we've had them in a restaurant. There are a number of different business settings where we have clusters occurring. So I think the important thing is for everybody to recognize that it is out in the community, and you should be taking precautions wherever you're at, and particularly in the workplace, to be looking for making sure people are separated and wearing masks and taking the appropriate precautionary measures.
Hi, Kevin, this is Siobhan. Could you just explain, you said something and I just didn't understand, the 7.75% of the population in relation to how many people were tested. Can you just explain that again to me?
Yeah, so the total number of tests that have been reported that were collected in Washoe County is 37,253. And so taking that number and looking at our overall population for Washoe County of 479,171 people, that number, that 37,253, is actually it's 7.77% of the population.
Thanks.
Sure.
Hey, Kevin, Brian Hoffman with KTBN2 News. I had a question about the asymptomatic testing. You said you didn't have any results from that yet, but are any of those results a part of the active cases that we have on the dashboard? And are we considering on doing that again, more asymptomatic testing?
So those are included in the active cases on the dashboard. While I don't have the final figures available, we're working on that. Anecdotally, I do have information that many of the people that were tested and were positive as asymptomatic individuals, when our case investigators contacted them, as we do to follow up with all positive cases, many of them, a large proportion, actually did have symptoms as they were that were discovered as they were going through the interview process with our case investigators. So those are represented. As far as additional asymptomatic testing, we do have the event in Incline on Friday to provide community-based testing there. Aaron had mentioned we're working with Health Plan of Nevada for another testing event at the end of the month, June 26th and 27th. That'll be down at Miguel Ribeiro Park. The Anthem testing is also coming up. I'm afraid I don't have the dates for that off the top of my head. But so there's some other testing events that are happening for the community moving forward.
Thank you. I had one other quick question too. You mentioned that if the public should observe any businesses not practicing those, safe practices for customers, that they should leave and to take action. Is that something that the health district would want to know about? We got a lot of people, I'm sure every other news outlet as well, getting inundated with emails about businesses not practicing safe social distancing and safe practices. Is that something you want the public to let you know of as well?
So my recommendation would be to report them to the entity under which they operate through their business license. So City of Reno, City of Sparks, or Washoe County, if they're unincorporated Washoe County, so that they can follow up if necessary to take appropriate action with that business. If there are workers in those businesses that are concerned about whether that business is following the appropriate guidance for their safety, they can also make a report to the state occupational safety and health program.
Thank you very much, sir.
Any other questions for Kevin Dick?
Hey, real quick, Carson with News 4. Kevin, you had said, was it 3% of the state's or what was the percentage of the state's population being tested? Did you mention that?
I didn't mention that, and to tell you the truth, I haven't updated that number yet. I just pulled the Washoe County number off of the table this morning, but yesterday, the statewide, the percentage of the population that had been tested was at 6.68%. So it's a little bit higher than that today, I suspect.
Thanks.
So moving forward, we are getting a bunch of people saying that protests will continue. Do you have any tips for those people wanting to go out and demonstrate, get their voices heard? I mean, obviously, social distancing is kind of out the window, but wearing masks, and are there any other precautions that any activists or protesters can take? Well,
I think the wearing masks is important. Frequent hand washing continues to be recommended. If they have hand sanitizer to take with them and use, they should certainly do that. And I don't know that social distancing is completely out the window. In what I've observed, I've seen people that are trying to maintain some separation as they're protesting, and I would advise anybody that's involved in the protesting to do what you can to try to stay spread out and separated. The other thing that I would recommend, I guess, is if people have been out and it has been crowded and not socially distanced, that they may want to get tested just to make sure that they haven't contracted it.
Now, are they able to go get tested if they aren't showing any symptoms, or would they need to wait for symptoms now, since the asymptomatic testing in Washoe County is not going on anymore?
Well, we do have some of these community-based events coming up, and they can certainly take our risk assessment as well to see if they can get in for the testing through that. That's available on the website.
All right, any more questions? Okay, hearing none. As always, feel free to reach out to me if you do have any questions or clarifications on anything for today. Like Kevin said, we'll get the updated case count numbers up as soon as possible. You can get those on the COVID-19 Washoe Twitter, covid19washoe.com, and we'll be updating the dashboard that's on covid19washoe.com and washoecounty.us/health. Thanks again for being a part of this. Thanks, Kevin and Aaron, for speaking, and everyone have a great day.
Thanks, Scott.